Hi, I'm Sam. I'm a senior studying neuroscience and global health.
Hi, I'm Chini. I'm also a senior studying determinants of health outcomes through the Program 2 major. Today, we're going to talk about our Bass Connections team in Uganda. But first, let's examine the neurosurgery landscape in Uganda. So in 2001, there was one neurosurgeon per 6 million people in the country. And so that's a total of 4 neurosurgeons serving the entire Ugandan population. To put that into perspective, there are 25 neurosurgeons at Duke Hospital alone. And so in 2014, the Duke Global Neurosurgery and Neurology Department of Duke Hospital partnered with local institutions in Uganda to train more neurosurgeons and increase the complexity of neurosurgery cases. In part due to their efforts, they've been able to train 6 more neurosurgeons today and hope to train 50 by 2020.
However, despite this increase in the number of neurosurgeons, patient outcomes remain poor. Even in Malago Hospital, which is one of DGNN's largest affiliates in these efforts, a closer look at preoperative and postoperative patient care revealed broader health systems factors outside of the neurosurgery ward that may influence patient outcomes. For example, specifically, this was low medication adherence, low health literacy skills, and a dramatically high infection rate. Therefore, DGNN established our Bass Connections team in 3 parts to focus on these broader health systems related factors. Specifically, these teams each seek to address these health systems challenges in contextually relevant, culturally appropriate ways to improve patient outcomes.
And so the medication management team seeks to improve medication adherence in the ward. They're doing this by, first of all, assessing the barriers to improved medication adherence. And they found that lack of proper documentation, a decentralized distribution of medication, and lack of awareness on the patient's medication and the disease that the patient is afflicted with are factors that are impeding improved medication adherence. And so they've set out different interventions like using a pill box to help with organization and putting up informative sheets for the patients to use in order to help them manage their medications better. The patient caretaker education team seeks to improve health education in the ward. Due to physician and nurse shortages, family members are the primary caregivers for patients, and sometimes they make fatal mistakes when caring for patients, like when feeding them or administering medication. And so we decided to go forward with improving health education in the ward by putting up informative posters, sending out SMS reminders to remind them of their task, and also employing an educator in the ward that will be a source of information for them. We found that the SMS intervention didn't work quite well because of the limited mobile phone use in the ward, and so we're gonna go forward with the other 2 interventions and monitor how that improves patient outcomes over time.
The final team, infection control, seeks to reduce infection rates through improving hand hygiene. As you can see in this photo, we installed hand sanitizer pumps throughout the ward, along with educational posters. We even created a bed-mounted pump so that staff had access to hand sanitizer pumps for between patient usage. Through a series of iterative projects, we discovered that increasing accessibility and visibility of this hand sanitizer pump system was correlated with increased usage by both staff and patient caretakers. Therefore, our future approaches include a staff accountability system for increased hand hygiene compliance, as well as a deeper investigation into how patient caretakers perceive infection control and hand hygiene so that our future approaches can better target this important group. Since the beginning of our BASS team, we have seen measurable and tangible impacts in each of these 3 challenges. For example, medication management reported increased knowledge among both patients and caretakers about the purpose of their medications, as well as the importance of maintaining a dosage schedule.
There are now more educational resources and materials in the ward for family members and patients to use when caring for patients, and infection rates have reduced by 25 to 30%. And we've also taken a more sustainable approach by partnering with a local hand sanitizer organization called Soraya to provide hand sanitizers to patients in the ward. Sam and I were fortunate enough to receive the BASS follow-on grant last year to kind of take on or further impact our team's outcomes, and we've been able to carry out individual thesis projects. Some of them are presented in posters today, just to show that our involvement in BASS Connections has really influenced our own personal academic paths, and yeah, we love it.
As Chidi and I head into med school this fall, we are excited and fortunate to bring with us the skills and experiences we have gained from 4 years of collaborating with Malago Hospital, DGNN, and our BASS teammates. Moreover, we are excited to continue following this team in the future as their projects continue to highlight the importance of including broader health systems factors in global neurosurgical approaches.
Thank you.
Thanks.